Hello everyone! Today we are going to talk about stomach cancer. One of the most common cancers affecting the digestive system is stomach cancer, especially in East Asian countries such as Japan. The stomach is a muscular sac located in the upper middle of your abdomen, just below your ribs. Your stomach receives and holds the food you eat and then helps to break down and digest it. Stomach cancer, also called gastric cancer, begins when cells in the stomach start to grow out of control. In this video, we will explain to you everything related to stomach cancer, its symptoms, how to diagnose it, and treatment strategy. So our role today is to answer most of your questions regarding stomach cancer. Today we have Dr. Kim, who is a leading doctor at Yangji Hospital. He's going to discuss with us everything about stomach cancer from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. What is gastrocolonoscopy and how often should it be done?
Gastric cancer incidence varies tremendously regionally. For example, the US has a much lower incidence in comparison to Korea by and large. So in the US, regular gastrocolonoscopy would not be justifiable. But if we take a look at Korea, Japan, Turkey, Germany, or Mongolia, in such countries, you are advised to have a regular gastric colonoscopy once you are older than 40, and especially for males.
Why? Why is it different?
It's related to food culture. Countries that consume great volumes of preserved or salted food are known to have a higher incidence of stomach cancer.
What are some signs of stomach cancer?
Nothing, which necessitates a regular screening program.
So, you should have examinations. It's the only way to know if you have stomach cancer or not.
Unfortunately, yes. Other cancers such as breast cancer, thyroid cancer, liver cancer, or colon cancer have a well-documented progression from its initial state to the end, which allows us to monitor the related blood markers to predict its course. But because gastric cancer is related to the food culture, its presentation is quite diverse. And we do not yet know of a specific marker which requires us to perform yearly endoscopies.
Then maybe just give us an idea about the types of stomach cancer that exists.
I can't quite answer that question because, although we do classify stomach cancer into 4 to 5 types, the accurate stage can only be determined after surgery. We have to resect the entire tumor tissue and examine the depth of gastric wall invasion and how far it has spread to the local lymph nodes to determine its stages, which range from 1 to 4. Although there is one cancer that erodes the entire stomach simultaneously, which we have to be very wary of. Unfortunately, this type of gastric cancer occurs frequently in young women and is practically impossible to survive 1 year after presentation. It's true that this one lethal type of cancer is classified, but by and large, gastric cancer is seen just as gastric cancer.
So I think what you said, from what I understood from what you said, is that women are more likely to have stomach cancer than men.
No, not at all. Men have a 3 times higher incidence than women. But unfortunately, although women have a relatively lower incidence of gastric cancer, if they develop cancer, they tend to have a quicker progression. Let me just add that this isn't grounded on biology. It's consensus between gastric cancer surgeons, so don't take it too seriously.
So is surgery the only options to cure stomach cancer?
No, the standard treatment for gastric cancer is endoscopic resection. About 60% of all gastric cancer patients receive endoscopic resection, but this number is only applicable to Korea and Japan. Few other countries have implemented a regular gastroscopy nationally, so it is rare to find the mass in its early stage. It's more desirable to perform surgery in such cases.
Is it like other cancers where after it's treated, it comes back again?
That would depend on its stage. Let's say surgery was successful, and patient A originally had a mildly invasive cancer with no locoregional lymph node spreading. If the biopsy confirms such a result, the probability of reoccurrence for the patient is almost non-existent. However, if a patient has completed a surgery without any peritoneal metastasis, but 8 to 9 regional lymph nodes have metastases, the reoccurrence rate for this patient is close to 80%. In short, progression at the time of surgery and the post-surgical biopsy result decides the reoccurrence rate. Stage 1 gastric cancer has a 95% chance of survival, while stage 4 has less than 5%. It's not particularly a good cancer. Prognostically speaking, it progresses relatively fast and reoccurs frequently.
So you said before that the difference between Korea and America, for example, is the diet or the nutrition. So how is the diet impacting stomach cancer?
Salted food, essentially Korean food, is practically founded on this base. That's why Korea has a higher incidence of gastric cancer. On the other hand, the more heavily meat-based diet of the US contributes to its higher incidence of colon cancer and breast cancer compared to Korea, which is why we think the cuisine of each country changes the cancer incidences. Unfortunately, the entire world is becoming more westernized, and the food also is causing a shift in the cancers that occur in Korea. More colon cancer and breast cancer. Fortunately, though, Korea has a solid medical system and has effectively decreased colon cancer rates. This is thanks to the capability to perform frequent endoscopies to remove precancerous lesions. Anyways, the cancer occurrence by type has become more westernized. And to come back to the question, essentially, it depends on the food culture.
So, last question. For example, if you had stomach cancer in your family history, is it more likely that you also have stomach cancer?
I can tell you that is inaccurate. There is no scientific evidence supporting the family history of gastric cancer. For example, breast cancer and colon cancer is biologically proven to be related to family history. But so far, there's no way to prove that gastric cancer is related to family history. It is true that because each household shares a similar diet, which can contribute to stomach cancer and can raise each individual's chances of developing stomach cancer. But to identify a relation to family history, a genetic relationship has to be proven, which is not the case with gastric cancer.
알겠습니다. 감사합니다. Today we learned many things about stomach cancer, and the doctor explained in details everything related to stomach cancer, including its types, symptoms, and management plan. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.